Well, there you have it, and we have a shutdown. Mr. Speaker, may I inquire as to how much time we have left?
The gentleman has about 5 minutes. You have 5 minutes remaining.
Thank you very much. Mr. Tonko, let us split that time. Would you like to close, or would you like to continue on?
No, I will just make mention of this, that I think the muddying up, if you will, of a CR, a continuing resolution, with first calling it a bill on the floor several times over, is disingenuous. You know, people place trust in us. You should honor that trust and not, nomenclature-wise, change the outcome here. We have an act of Congress that was signed into law. This is a law of the land, in this case, to provide for affordable, accessible, quality health care. If you didn't like that result, there were opportunities to change it. Candidate Romney, Governor Romney, Representative Ryan as the Vice President, they ran to repeal the Affordable Care Act. The people of this great nation decided in that presidential election for the re-election effort of President Obama that they were going to stay with the president. So that statement was made. The highest court in the land reviewed it for constitutionality. They approved that, gave it a thumbs up. Why are we still dwelling on this situation? Why are we bogging down the process where you either defund, deny, repeal, whatever the course may be? We have seen it over and over again, so that 45, 46, 47 votes in a row to repeal were all denied. And when you do the same thing over and over and over again, expecting different results, people have defined that as insanity. So we have not provided the sort of integrity this process needs. We have not shown the respect to the individuals and families that are automatically showing today with the very aggressive, very involved activism today to sign up with the Affordable Care Act. We are disregarding that. We're disrespecting that. And I think, you know, the polling that was done, I saw a poll today that said 71% of the American public does not believe we should hold up and fold the government, shut down the government because of an effort to repeal the Affordable Care Act. So the public is speaking. They're telling us, do it better. And thank you, Representative Garamendi, for the opportunity to join you.
Mr. Tonko, thank you so very much for joining me once again. I'm going to wrap this up with a note of sadness. The American government is shut down. It is shut down because of a conflict that has developed between the Democrats and the Republicans here in the House and on the Senate side. It's a conflict that didn't have to happen. We could have worked this out in a conference committee had Speaker Boehner chosen to appoint conferees. It didn't take place. A continuing resolution, the Democrats compromised seriously and accepted a continuing resolution at the sequestration level. Far less money than we think is necessary, but we wanted to keep the government running. We refused to abandon the Affordable Health Care Act and the millions upon millions of Americans that have benefited from that and are benefiting today as the exchanges are going into place. California's had an enormous success, and it will work. And as it works, I think we'll find that those Americans, some 40 million that do not have health insurance, will, in the next months ahead, get their health insurance at an affordable cost. And this is already bending the cost curve for American health care. It's a good thing, but it's also a very sad day. There is absolutely no reason that this government was shut down except for the intransigence of our Republican colleagues demanding the repeal of things like the Patient's Bill of Rights, demanding that we go back on a promise that America has tried to have for some 60 years now of providing health insurance to all Americans. We're moving towards that with the Affordable Health Care Act, or Obamacare. It's a sad day, but it's also a hopeful day. It's a hopeful day because the exchanges are working. There'll be computer glitches and there'll be some error in the mathematics, but across this nation, the exchanges are working, and the American public that is uninsured, not the insured, but the uninsured, they're going to the exchange, and they're saying, let me shop. Let me shop in a rational market where I can compare prices and quality and providers. They're doing that in California, New York, and in Texas, all across this nation. So we're hopeful. It's a hopeful moment, even though we have spent the last week battling out the fundamental question: is America going to move forward and stay in business, or is the government going to shut down? The Republicans chose to shut down the government. Are Americans going to get health care? The Republicans said no. The Affordable Health Care Act must be repealed. The Democrats said no way, no how. It's in place, folks. The Affordable Health Care Act is in place, and the exchanges are working, and millions of Americans will find an opportunity to buy insurance in a competitive market, free market, not a government market, but a market structured by government so that the private sector can display its insurance policies, what their price is, what their quality is, which doctors they can go to. It's a sad day, but it's also a hopeful day. Mr. Speaker, with our 54 minutes, we thank you for the opportunity to explain this, and we yield back our time.
The gentleman yields back. Under the Speaker's announced policy of